SABC News presentation.
It is just gone 8 o'clock and you're watching A View from the House, coming to you live from Parliament in Cape Town. My name is Asanda Mbeche. Well, it's Constituency Day. The two houses of Parliament are not sitting, and that gives us time to recap on work done by members of Parliament last week. In our program today, we'll bring you outstanding questions to ministers in the social services cluster. We also have members' statements. Last week, we brought extracts from questions to the Minister of Social Development, Bathabile Dlamini. Today, we continue our coverage with more questions to the ministers in the social services cluster. Our first follow-up question to Minister Bathabile Dlamini comes from Ms. Yolanda Botha of the ANC.
Thank you, Honourable Speaker. I would like to know from the Honourable Minister when the biannual conference on substance abuse will be taking place, so that we, together as Parliament, government and civil society, can evaluate whether the resolution taken at the last biannual summit on substance abuse had any effect on curbing this scourge.
The Honourable Minister.
Mr. Speaker, next week the CDA will be launched because we've taken a long time to launch the CDA, more particularly because the outcome of the members that were appointed or elected by Parliament was not a representative. So we had to look for people from other areas, more especially areas where there is a problem of alcohol and substance abuse. And then secondly, because there has been a call to action by many organizations, we thought that we should try and ensure that we consult extensively, and we have done that. And then after the launch, we are going to have a meeting of the committee, and so that we agree on the time frames and how they are going to be implementing the program of action. And we think for now, Mr. Speaker, it is the time to act, it is the time to implement the program of action, and then we can have a conference after ensuring that what came out in the last summit is implementable. Thank you, Mr. Speaker.
Reverend Kenneth Meshwe of the SCDP had a follow-up question relating to the fight against substance abuse.
The damage of substance abuse, particularly TIC, to the brain and its devastating effects on family life necessitates a robust approach by government to deal with this scourge. Members of TIC abusers' families are reportedly so traumatized that they have to be taught, and I quote, how to live again. Abusers and addicts become verbally abusive and dangerously violent when they are high on TIC. Now, what I want to know is whether government is planning to have treatment centers where people that are addicted can find treatment. There are NGOs and there are private institutions that deal with abuse of substances. But because of the costs, many people in poor communities cannot afford them. So what I want to know is whether government is doing anything to help those from poor communities whose addiction is causing the destruction of their own families. And if there are any plans, we want to know when those plans will be put into action. Thank you.
Honorable Member Meshwe, 2 weeks ago, as a social development, we informed the Department of Health that Wunga should be classified as a substance. And because there are a number of people that have died out of a wunga, because it has a vim, a jig, retex, and other things. There is a research that is made out of these things, and also by the time people go to centers for rehabilitation, it's late in some of the places. And then number 3, one other issue that we are looking into as government is to ensure that in all the provinces we have rehabilitation centers, because it's not all the provinces that have rehabilitation centers. So we always have a waiting list. But also we have mobilized communities to form community-based organizations, because you need firstly to campaign and for the prevention. And then number 2, we have also asked communities to form NGOs, because it's useless for someone to go to town for rehabilitation, because most rehabilitation centers are in towns, and then not have an area at a local level where he or she can go for continuous consultation. So we have looked into those areas. Thank you very much.
And another question to the Minister.
In questioning the effectiveness of the CDA is one thing, but what interventions are there to deal with this particular aspect of the problem?
That were reported to government, because we had an operation center for the children. So we